Hair care and shampooing. Hair combing. To perform hair care, introduce yourself, identify the patient, and explain what you are going to do.
This is Gretel. I am Kervin and I'm your
Hand
assistant here.
hygiene and provide
And we'll
privacy.
do comb your hair.
Determine
So
if
you can
any
have a look
contract indications to the procedure.
sanitize my hands.
Ask the patient for any preferences in hair care product if she like hair comb or style in particular way. Encourage if she feels uncomfortable in any time. Apply clean gloves and place a towel over the patient's shoulder under her head if she is on bed. Inspect the condition of patient hair and scalp. Use comb or fingers to part into 2 sections, and then into 2 more sections. Be sure to dump the hair lightly with water, conditioner, or alcohol-free detangle product before combing it. Move your fingers through the hair to lose any large tangles. Using a comb, start either the side of the head and comb from the scalp towards the ends of the hair. Continue until you comb through all the patient hair. Finish by combing it in the place to shape and style it.
Mrs. Gretel, I'm done with the hair comb. You want me to change the style of your hair? Put a ponytail or just let it like this?
I want a ponytail.
Okay, sure.
Make it neat. Okay. Yeah, that's okay.
Okay. And that.
Thank you.
Over.
Hair care for a bed-bound patient. Introduce yourself. Check to see if the healthcare provider order is required, and to be sure there is no contraindications in positioning the patient.
Can I have your name, sir?
Make sure to ask the patient's name or date of birth. You have to tell him that you need to get the supplies needed. Then when you're back, you have to inform him that you need to help him to arrange him to start shampooing his hair. Then start by wearing clean gloves. And inspect the hair and scalp for abrasion, inflammation, laceration, and infestation. And determine if the patients need some special treatments such as shampoo for dandruff, lice, or removal of mud and blood. Put the disposable gowns in addition to wearing gloves if lice are present. Make sure your patient is supine with his head and shoulder at the top edge of the bed. Place a waterproof pad under his shoulders, neck, and head. Slide the shampoo board under this head and the wash basin under the trash spout. Place a rolled towel under the patient neck and the towel over his shoulders. Comb his hair to remove hair tangles. Put a small towel or washcloth over his eyes. If the patient wishes, he can hold it in place. Slowly pour the water from the pitcher over his hair until completely wet. If you noticed any mud and blood, use hydrogen peroxide to dissolve the clots. And then rinse with saline, but be careful of doing so for open wounds. Then apply a little shampoo. Work up a ladder, both using your hands. Begin at the hairline and work toward the nape of the neck. And then shampoo the side of the head and massage the scalp by applying pressure with your fingertips. Be sure to lift your patient head slightly with one hand to wash the back of his head. Rinse the hair with water from the pitcher. Make sure the water drains into the basin and keep rinsing until the hair is free of soap. Grab the patient hair with towel. Dry his face with the cloth he used earlier to protect his eyes. And dry off his neck and shoulders if necessary. And finally dry his hair and scalp by the towel. Use too if becomes saturated. And take away the shampoo head board. Then comb the patient hair to remove any tangles. If the patient wants any oil or conditioner, apply it now. Continue until the hair is tangled free. Assist the patient in finding a comfortable position. Put the side bed up and the bed into the lowest position. Dispose of any used items and store your reusable supplies. Remove gloves and hand hygiene. Document shampooing if your agency requires it. Using shampoo cap.
Good morning, Mrs. Gallo. I will shampoo your hair today.
Yes, dear. Thank you, please.
You might need to shampoo a patient's hair using a disposable shampoo cap. Help the patient into a comfortable position. She can sit in a
First,
chair
Mom, I will
or upright
comb
in
your
bed.
hair and I will check your
Apply
scalp.
gloves and comb her hair to
you.
remove any tangles or debris.
Are you comfortable with your seat, Mom?
Yeah,
Preheat
fine,
the
dear.
shampoo cap per the manufacturer's instructions. Then open the package and put the cap on the patient's head. Be sure to tuck all
I
of
will
her
ensure
hair
that all
beneath
your
it.
hair will be fit in the
Check the
scalp.
fit and then massage her head through the cap. Keep massaging for 2 to 4 minutes, according to the package directions. You might need additional time if the patient has longer hair or if her hair is matted with blood. When you've finished, take off the cap and discard it in the trash. Do not dispose of it in the toilet. Ask the patient if she'd like to have her hair dried. If so, dry it with a towel or dryer. Then brush or comb it as the patient prefers. Dispose
want
of
to
the
dry your
used
hair?
towels.
Yes,
Remove your
please,
gloves
dear.
and
Thank
perform
you.
hand hygiene.